adds up to this PCOS.
Okay.
Well, polycystic ovarian syndrome is a syndrome, as it implies, and there's many components, and not everybody meets all the components, right? But the most common symptom is these long or absent cycles.
Okay.
And that is usually because your androgen levels, which we think of as male hormones, like the testosterone family, we have those hormones in our system as well, but women with PCOS tend to have them a little bit elevated.
Okay.
And when we have a little bit elevated testosterone levels, that causes that LH spike not to happen regularly.
Oh,
and
okay.
because you're not spiking, you're not ovulating, and
Right.
then the rest goes from there, right?
Okay.
The other pieces of this, not only are the long cycles and the elevated testosterone, but sometimes when we look at your ovaries, we see that the ovary actually has multiple cysts on it, which are basically that in this cycle, you've got all these eggs that are like trying to ovulate, and they're like waiting, like, where's my trigger? Where's my trigger?
Yeah.
And it never comes. And so they're just sitting there mature waiting, and nothing happens.
Oh, okay. Yeah, I've never gotten like a scan or anything.
Yeah. So sometimes women with PCOS, when we do we do a transvaginal ultrasound to look at your ovaries.
Okay.
We look at the ovaries instead of all the eggs. You can look while they're doing this. Instead of all the eggs or all the follicles, which is what contain the eggs, looking like a cookie, like a chocolate chip cookie, like just sort of distributed through the middle.
Mm-hmm.
If this is your ovary. Then the people with PCOS, all of those follicles sort of cluster around the edge, and we call it the ring of pearls. So it looks like a necklace instead of a chocolate chip cookie.
Okay.
That's sort of like classic PCOS.
Yeah.
You may not have all of these symptoms, right? But you have the long cycles. We'll check the hormones. We'll check the ovary.
Okay.
You need 2 of them in order to get the diagnosis of PCOS.
Okay. Perfect.
So regardless, we're going to take care of you.
Thank you.